Hello students, welcome to the class. So before going to start the class, so let us wait for 2 minutes, okay? Let others to join the class. Then we'll start the class, okay? Hello students, welcome to the class. So today we are going to start a new topic. So that is the human health and the disease, okay? So let us start the class. So before going to start the class, can you tell me whether I'm audible and screen is visible, okay? Can you tell me whether I'm audible and screen is visible? I'm going to launch the poll. You can answer me. Okay, fine. Fine. I'm audible. Screen is also visible. Fine. Let us start the class. Okay. So student, here is the easy question for you all. Okay. So can you answer me for this question? The question is, which one of the tests is considered as gold standard test for diagnosing COVID-19? Okay, I think everyone know that, right? So anywhere if you have to travel means you have to give the test, right? Which is the test that just remember that. Okay, yeah. So the options are real-time RT-PCR and option B rapid antigen test, option C rapid antibody test, and option D ELISA test. Okay, so you can answer me. I will run the poll. Okay, I will launch the poll. You can answer me in the poll. I will give you 1 minute of the time. Answer me this very easy question. Okay. Okay. So yes, fine. So everyone given the answer. The answer is real-time RT-PCR, right? Can anyone tell me what is the full form of RT-PCR, student? RT means, can anyone tell me? Reverse transcriptase. One minute. I'll take the another color, okay? Okay. The reverse transcriptase, right? Reverse transcriptase PCR. What do you mean by PCR? Polymerase chain reaction, right? Polymerase chain reaction, right? Very good, very good. Good morning, good evening, Manasa. Sorry, good afternoon, Manasa. PCR, yes, very good, correct. Fine. So the correct answer here is RT-PCR, right? Okay, let us quickly start the class. Okay, fine. So human health and disease. Okay, so what are the things we are going to study in this mainly? Okay, so we are going to talk about common diseases in the human and immunity and AIDS, cancer, drugs and alcohol abuse. Okay, so these all the things we are going to study. Let us start the class. What do you mean by health actually? What do you mean by health? Does it mean that I'm not having any disease means? Does that mean that I am a healthy person? No, right? It should be physically well-being, mentally well-being, socially well-being, and emotionally well-being, right? So this all the well-being state will call it as health, right? For example, if I am a healthy person, in the public, I'm not going to be act as a healthy, I'm not acting as a good person. What it will mean that, right? So they will think that I'm a mad, right? So yes, so it should be mentally well-being, right? Yes, and socially well-being and emotionally well-being, right? So these all the things we'll call it as a health, right? Yes. So then coming to the what is a disease, right? So what is the disease actually? For example, if we don't having any disease, our body system is going to work normally, right? Normally, right? If I am a normal, so whenever I'm having the headache or whenever I'm not feeling well, then only I'm going to take a rest, right? So why the rest is required? Our body is require a rest. So that's why I'm also require a rest, right? So other than that, when we don't having any diseases, our body is going to function normally, right? So yes. So then what does the disease mean? It is a harmful deviation. Something happened to our body, right? That is what we will call it as a disease, right? Yes. Malfunctioning of the body with the specific symptom. Simply our body is not going to be tell that I'm not feeling well. Okay. It will give some symptoms, right? For example, if I'm having a fever, it will increase the body temperature, thereby showing that you are having the fever, right? So if you are having any bacterial disease or having any fungal disease, it is going to show on the body, right? It is going to show some symptoms, right? So that is what called as that disease. Okay. So malfunctioning of the body with the specific symptom. The body is not going to function normally on that disease condition, right? Fine. So whenever we are talking about the disease, there are two types of the disease. One is congenital disease and another one is the acquired disease. What do you mean by congenital? The disease which came from birth, okay, which came from by birth, we will call it as a congenital disease. Student, do you remember that in the inheritance of the biology, you have studied about the chromosomal disorders like Klinefelter syndrome and the Turner syndrome, right? So these are due to the less number of the chromosome or increase in the number of the chromosomes, right? So these all are by birth only, right? So that's why we will call it as congenital disease, okay? Congenital disease from birth, okay? By birth only you are getting that. So that we'll call it as a congenital disease. And what do you mean by acquired disease? Acquired disease means in the lifetime you are going to be acquired, okay? So in the lifetime you are going to be acquired, or after the birth, which are the disease you are going to get, that we will call it as the acquired disease. So that is in the lifetime you are going to get the disease, we will call it as the acquired disease. Okay. In the acquired disease also there are two types. Okay. One is a communicable disease, another one is non-communicable disease. For example, if you take the communicable disease, coronavirus, okay, coronavirus, you are going to get the disease virus, right? So that is also viral infection and some bacterial infection. These all are communicable, right? So then coming to the non-communicable, so these non-communicable diseases are not communicable. For example, by sitting with that person and by eating with that person, okay, you're not going to get that disease, okay? So that is what we will call it as non-communicable disease. For example, deficiency syndromes. Because you can tell me that if you are having the deficiency like protein deficiency, you will get the marasmus disease, right? So marasmus. So that is not going to be transmitted to the another person. That is a fault in you, right? You are not eating the proteinaceous food. Because of that, you have got the marasmus, right? In the children, you will get the marasmus usually. So that is not going to be transmitted to the another person. And coming to the degenerative brain disorder. So that is not going to be transmitted from the one person to the another person. And addiction, if you're an alcoholic person or if having the drug addiction, it is not going to be transmitted to another person by sitting with him or by eating with him other things. Okay. Then allergic reaction and mental disorder and the cancer. And cancer is also, you have to remember, it is a non-infectious and it is non-communicable. Okay. By sitting with by talking with and by sharing the things with the cancer patient, you are not going to get the cancer. Okay. Yes. So that's why we'll call it as the non-communicable disease. And you can take a diabetes. Diabetes is also non-communicable, right? It is not going to be transmitted from the one person to the another person by sitting and by eating with them, right? Yes. So then coming to the communicable diseases, there are mainly two types. Okay. One we'll call it as a contagious and another one is non-contagious. What do you mean by contagious? Can anyone think? Can anyone think? What do you mean by contagious? Nothing. Contagious means it is going to be transferred to the direct contact. Okay. This type of disease is going to be transferred through direct contact. For example, if you take the chicken pox, smallpox, or any cold, common cold, these all the things is going to be, it is going to be spread directly, right? Directly. So that's why we call it the contagious. When it comes to the non-contagious, it is not going to be transmitted by directly. For example, by the vector, it is going to be transmitted. So that thing we'll call it as non-contagious, means indirect. Okay, students, indirect. Or example, you can take vector mediated. Okay, if you take the example of malaria, okay, how the malaria is going to be transmitted? By sitting with the malaria patient, you are going to get the malaria? No. It is going to be transmitted by malaria parasite. 1 minute. Fine. So it is going to be transmitted by the malarial parasite, right? Sorry, it is going to be transmitted by the female Anopheles mosquito. Here, female Anopheles mosquito is going to be act as vector, right? Yes. So this is the indirect method. Okay. So student, do you have any confusions here? Can anyone tell me, Janvi, Mantha, do you have any confusions here? No? You can contact me, student, if you have any noise disturbance or you're not, the sound is not audible means. Fine. So then how the disease is going to be causing, how the disease is going to be spread. Okay. Student, there are mainly exogenous and another one is the endogenous. Okay. What do you mean by exogenous? Is the any chemicals from the outside the body, any chemicals means any pathogen from the outside the body which is causing the disease. That we will call it as the exogenous. Outside the body, we'll call it as exogenous. Then the chemicals which is present in our body only, it is causing the disease. That we will call it as the endogenous. For example, if you take the uric acid, okay, uric acid in the body, it is going to be increased. Then it is going to cause the arthritis, joint pain, right? Joint pain it is going to be caused. That is what we will call it as the endogenous. Okay. So example, endogenous is inside the body, inside the body. Inside the body, the chemicals is going to be increased. So, or decreases. For example, if you take the anemia, anemic. So that is due to the red blood cell less, right? Due to the decreases in the red blood cells, you will get the anemic, right? So that is also the endogenous disease. And uric acid. Example, you can take the uric acid. Uric acid, okay? Increases in the uric acid, it is going to cause arthritis. Arthritis, that is we call it as a joint pain. Joint pain. Okay. So that's why the uric acid we will call it the endogenous. Okay. So then how the transmission of the disease is going to be occur? Okay. I have told you that one is the direct transmission and another one is the indirect transmission through the vectors. Right? Fine. So see here. So direct transmission. Which are the direct method you are going to get the, which are the direct transmission method you are going to get the disease? One, see here, contact with the infected person. Okay. So then second one is droplet infection. So in the droplet infection, it may be a sputum of the patient, or it may be a cough of the patient, or it may be a sneezing of the patient. So by that, you are going to get the droplet infection. Then contact with the soil and animal bite and the through the placenta from the mother to the child. Okay, fetus. So that is what we call it as the direct transmission. So see here. So here we are given the 1 minute. See here. So here we are given the examples of the direct transmission. So that is the smallpox, chickenpox, and the ringworm. See here, this is the smallpox. Okay. So this is the chickenpox, and here they are giving the ringworm disease. So that is the fungal disease. Okay. Fine. So let us come to the droplet infection. I have told you that sneezing, coughing, and spitting, sputum of the patient. Okay. So which are the examples of these diseases you are going to get by the droplet infection? Tuberculosis, influenza, cold, measles. Given. Okay. So they may be asked the questions like this. Okay. Which one of the disease is not going to be come through the droplet infection? Okay. So that's why you have to remember this. Okay. Fine. So let's go to the soil. Okay. Contact with the soil. You're going to get the tetanus. Okay. The tetanus is mainly caused by the Clostridium tetani. Clostridium tetani. Okay, student. So whenever you are hurted by the rod, iron rod, you're going to take the injection, right? What is that injection, student? Can anyone tell me? Whenever you hurted by the iron rod, you're going to get the injection, right? TT injection. We'll call it as a TT injection, right? TT injection, right? So why we are going to take the TT injection? this tetanus bacteria, so there is a Clostridium tetani, it is also going to grow on the rods. Okay, so that's why if you're infected by that, so it is a very dangerous, right? So that's why you'll get the TT injection after the any infection by, sorry, any hurted by the iron rods. Okay, and some children also, there they will eat the soil, right? By they will, by eating the soil, this Clostridium tetani will move through the soil also, then it is going to pass the infection. Okay, so that's why we have to careful while the children are playing, when they're eating the soil, they will, by they will eat the soil, right? So there also we have to be very careful. Fine. Next, animal bite, obviously rabies. Not only by the dog you are going to get the rabies, by the other mammals also. For example, rabbit, and by the cat you are going to get the rabies. Okay, not only by the dog. Okay, fine. So let us go to the through placenta. Through placenta you are going to get the German measles, HIV, and the syphilis. Student, it is very important. Remember that through the placenta you are going to get the German measles, HIV, AIDS, and the syphilis. Syphilis is also going to be get through the sexual interaction. Okay, sexual contact. Fine. Sexual contact. From the sexual contact, you are going to get the syphilis and the gonorrhea also. Fine. So here is the question for you. Which one of the following diseases cannot be communicated through droplet infection? Okay. So can you answer me, student? Which one is the correct answer is? I will run the poll. You can answer me in the poll. Okay. Answer me. Or you can answer me in the chat box also. No problem. Answer me in the chat box. Jainmi Mansa. Can you answer me, students? Can you answer me which is the correct answer? I know you all of you answering the question, but you're not answering here. Answer me. Then I will come to know that you're answering here also. Okay? Yeah. Very good. Very good. No, just I will give a time. Just think, student, which one is the correct answer? Just think. Droplet infection. Droplet. See here, influenza, measles, and tuberculosis. And HIV they are given. Think which one is the correct answer? Is that HIV AIDS is going to be come from the droplet infection? No, right? No, that HIV is not going to come through the droplet infection. It is going to be come through the, right? How it is going to be transmitted? I told you now only. It is sexually transmitted disease, right? HIV. Right? So that's why option C is the correct answer. Influenza, measles, and tuberculosis. So these all are through the direct contact. Through the direct contact, you are going to get the disease. HIV AIDS is through the sexually transmitted disease. Okay. Sexually transmitted. Thank you. Okay, fine. So let us go to the indirect transmission. I have told you, indirect transmission is through the vectors, right? So vectors, which are the things? See here. It may be arthropod vector like the insect or through the housefly, and through the vehicle-borne method and hair-borne method and format-borne method and the human carrier. Format-borne method, for example, if you take, I'm having the disease. Okay, I'm having the corona. Okay, so by touching this pen and by touching the pen or by whichever the things I have used it. So by touching that, the people are getting the disease, right? So those disease we will call it the format-borne method. Okay. If I used the spoon, that spoon was used by another person, thereby is going to get the disease, right? So those things we will call it as the format-borne method. Okay. So then coming to the human carrier, the best example they are given in the textbook. So that is the Typhoid Mary. Okay. Her name is not Typhoid Mary, but they are given the Typhoid Mary. Okay. So I mean, she is a typhoid carrier and she is a cook. Okay. She is a professional cook. By through her cook, what she transmitted the typhoid disease. Okay. So that's why we will call it the human carrier. Okay. Her name is actually Mary Malone. Okay. Her name is Mary Malone. She's a cook. Okay. Whenever she's cooking, So the droplet was has been added to the food, right? Through that droplet, so many of the people have heated that food, have got the typhoid. Okay. So then later the investigation was gone. So all the patients have told that all the patients have told a similar thing, that they're used to eat in the Mary Malone Hotel, or we will call it as by the Mary Malone. Okay. So then she is also tested. Then they came to know that Mary Malone is the typhoid carrier. Okay. Through her, the typhoid was transmitted. Okay. So that's why we call it as the typhoid Mary later that. Okay. Typhoid Mary. Okay, student. Fine. So she is a human carrier. Fine. So let us go. Some examples I have given here for the arthropod vector, how it is going to be transmitted. See here, rat flea. You all know about the plague, right? So plague, so the mouse is having the flea, right? On the mouse, there are some fleas there that is going to carry the bacteria. Okay. Through that bacteria, it is going to cause the plague. Okay. Plague is by the rat flea. Okay. Plague. So then coming to the sleeping sickness. So it is usually protozoan disease. Okay. Protozoan disease. What is that? Sleeping sickness. Okay. It is going to cause by trypanosoma. Remember here, student. Trypanosoma. Okay. Sleeping sickness is going to be caused by the trypanosoma. But the vector is there who is going to be carry this protozoa to the human. So that is we call it as the T-safe fly. Okay. T-safe fly is the carrier vector where it is going to carry the trypanosoma. Okay. It is going to carry the trypanosoma in this, and through that it is going to cause the disease. What is the disease? Sleeping sickness. There are two sicknesses there. One is the American sleeping sickness and another one is the African sleeping sickness. Okay. So then coming to the housefly, typhoid, cholera, dysentery, and amoebiasis if you take. So this all the thing is going to be come through the housefly. Okay. So then coming to the mosquito. So everyone know that, right? Mosquito. From the mosquito, you're going to get the malaria and dengue and filaria. Okay. So this all the thing is by the mosquito. Remember that mosquito by the malaria and dengue and the filaria. Okay. And leishmaniasis is by the sandfly. Okay. So these all are the arthropod vector which is going to cause the disease. Okay. Fine. It is acting as an indirect method of transferring the disease. Okay. Fine. So I think you have studied about the vector, right? Vector in the biotechnological process. I only teach you, right? Vector. So same thing. So this is also acting as a vector to transfer that pathogen into the humans. Okay. So fine. So how this agent is going to cause the disease? So there are mainly two types. One is tissue damage and another one is the toxin secretion. Okay. So let us study about that. How it is going to cause the tissue damage. See here, student, I have taken the example of rabies. Okay. So here I have taken the example of rabies. Can anyone tell me rabies is caused by virus, right? Virus. So that virus is rhabdovirus. Rhabdovirus. Everyone know that. So rabies is caused by the dog, right? I have told you now only. It is also caused by the other mammals also, cat and the rabbit and all the other things. Okay. So see here what happened. Whenever the dog was bitten, the dog is already affected by the rabies virus. Okay. So it is in the final stage. Okay. Whenever the dog was bite the person, so that is in the final stage of the rabies. Okay. It was bitten the person. The virus was near the tissue. What it will do? It will multiplicate. Okay. It will increase in the number. Okay. So then what will happen? After increasing the number, it have to travel, right? It has to go to some other parts of the body and it has to damage the other parts also, right? So what it will do through the peripheral nervous system, okay, through the peripheral neuron, okay, through the peripheral neuron. So it will go, see here, from the peripheral neuron, it is reaching the brain, okay, it is reaching the central nervous system. To the peripheral neurons, it is reaching the central nervous system, and there it is going to be cause the damage. Okay, what damage it is going to cause? It is going to cause the cerebral cortex damage. Cerebral cortex damage. Okay, it is going to cause the cerebral cortex damage, that is how it is going to be damaged, right? So that's why we'll calling as the tissue damage. Okay. So where it is going to see here, it is passing from the down to the from the to the central nervous system, right? So whichever this virus is going to be passed that area, so it is going to be cause the damage of the tissue. Okay. See here, it is going to be go like this, right? It is going to cause the damage of this all the tissue, and it is going to be enter into the central nervous system. There also it is going to cause the cerebral cortex damage. That is also the tissue, right? Yes. So that's why the rabies, we famously call it as the hydrophobia also. Hydrophobia also. What happened in the hydrophobia is the person who is having the rabies is suffering from, he wanted to drink the water but could not able to drink the water because this rabies virus damaged the trachea system here. Okay. So then he had the thirst, but couldn't able to drink the water. Okay. So that is how he has the phobia on the water and the liquid items. Okay. So that is why we will call it the hydrophobia and also the photophobia also. Photophobia also. Okay. So this is how, and after it is damaging the cerebral cortex, it is also spread through the saliva of that person also. The person who is affected by the rabies virus, in saliva also it is replicated. Now the person's saliva is also having the rabies virus. Okay. So this is how by the tissue damage. So the another thing is toxin secretion. So the two things, second things. Okay. One is the exotoxin and another one is the endotoxin. I think you know about the gram-positive bacteria and gram-negative bacteria, right, student? Yes. See here, this exotoxin is secreted by both the bacteria, gram-positive and gram-negative. Okay, see here. What is this exotoxin? The bacteria was entered into the blood, right? So now see here, this bacteria was entered into the blood. So it started secreting the chemicals, right? Started secreting the chemicals. Through these chemicals, you are getting the disease. Okay, through these chemicals released by the bacteria, you are getting the disease. So that we will call it as the exotoxin. What is exotoxin? So these exotoxins are, 1 minute. Exotoxins are, chemicals released by bacteria. Okay. So then it is released by both the gram-positive bacteria and also the gram-negative bacteria. Then coming to the endotoxin, see here, you know what is the bacteria envelope is made up of, right? So you know what is the difference between gram-positive bacteria, gram-negative bacteria. It is mainly due to the peptidoglycan layer, right? The peptidoglycan layer was thick in gram-positive bacteria, thin in gram-negative bacteria, right? Other than this thin peptidoglycan layer, the gram-negative bacteria is also having some polysaccharide coat, right, student? So that's why it will not take the gram-positive stain. Okay. After washing with the stain, it is not going to be show the gram stain, right? So that is why it is going to be stained by the counter stain, gram-negative bacteria, right? So this is the polysaccharide coat. Polysaccharide coat, right? So this is the part of the cell wall, right? So that's why we'll call it the endotoxin. Polysaccharide coat is mainly due to the endotoxin. Okay. So what happened? Whenever this bacteria was break up, okay, whenever this bacteria was burst inside the cell, inside the blood, okay, inside the blood, it is going to be burst. Okay, inside the cell, it is going to be burst. It is the blood. Okay. Then it is going to cause the disease. Okay. So see here, that polysaccharide coat is there. That polysaccharide coat is only the endotoxin. So whenever this bacteria went inside the blood, it will burst. Okay. Whenever it is burst, it is releasing the polysaccharide coat. Thereby, it is going to cause the disease. Okay. So that's why it is called as the endotoxin. It is inside the part of the bacteria. Okay. See here. Then can you tell me from which bacteria is going to get the endotoxin? From which bacteria is going to release the endotoxin? Can anyone tell me? Only the gram-negative bacteria. Gram-negative bacteria. Because the gram-positive bacteria do not have this polysaccharide coat. Okay. It is having the thick peptidoglycan layer. Only the gram-negative bacteria is having the polysaccharide coat. So that's why endotoxins are released by only gram-negative bacteria. Okay, fine. Okay, so let us come to the common diseases, student. Okay, now we are starting a bacterial disease. Okay, fine. Can you recall whichever the bacterial diseases you know? Here I have given the names also. If you know other than this, you can tell me. Okay, fine. So student, these names you have to remember. Okay, because in the exam they may ask you, they may give you some bacterial disease name and they may tell you that. So recognize which one is the bacterial disease or not the bacterial disease or the viral disease. So that's why you have to remember some few of the bacterial disease name also. Okay. So see here, they are given that typhoid and anthrax, cholera, leprosy, pneumonia. Pneumonia is also caused by the bacteria, and plague, and dysentery, and diphtheria, whooping cough, and tetanus, and tuberculosis. Now only I have told you, tetanus is caused by the Clostridium tetani, right? So this all the things are bacterial disease. Okay, fine. How can you remember this? Yeah. So here is the easy way. This is the easy mnemonic I have given for you. Takla Papa Dawat tea. Okay. So you can easily remember by this method. So, okay. Typhoid, anthrax, cholera. Can anyone tell me typhoid is caused by which bacteria, student? Can anyone tell me typhoid is caused by which bacteria? Salmonella typhi. Right, student? Some at least you don't know all the bacterial disease name means. Can anyone tell me some of the names at least? Cholera is caused by which bacteria? It is very easy. Vibrio cholerae. Okay, student. Pneumonia. Can anyone try? Pneumonia is caused by Streptococcus pneumoniae, right? Streptococcus pneumoniae, right, student? Streptococcus pneumoniae, right? So then plague is by the Yersinia pestis. Okay, fine. So then whooping cough by the Bordetella pertussia. Okay, student, fine. So these all the things. If you know the other bacteria means you can tell me. Okay, fine. So these all are the bacterial disease. You can remember this causative agents also. These all the things in the yellow things I have written that causative agent. So that is the in the white color. So those all the things are the disease name. Fine. Okay, fine. So in your subject, there in the textbook, they are given the 2 bacterial diseases that we are going to study. Okay. So which are those bacterial diseases? See here, typhoid. You know all typhoid is a fever, right? Typhoid fever will get whenever we go for the doctor, we are having the normal fever means the doctor will tell us to go for the testing. They will suggest us for the viral test. Okay, viral test is mainly given for the typhoid. Okay, they will tell for the viral test, and after the coming the result, we came to know that this is a typhoid, right? How we are going to get the typhoid disease? It is normally fever, I have told you, right? So this is going to be caused by Salmonella typhi. I have told you now only, right? Salmonella typhi. How it is going to be transmitted, student? It is going to be transmitted by fecal oral route. Okay, fecal oral route. Remember this thing. Okay. Then what are the symptoms when we get the typhoid? What are the symptoms we are going to show? You are going to be a future doctor. You have to know the symptoms, right? Yes. Constipation, then abdominal pain you are going to get, and sustained fever, and intestinal perforation, and loss of appetite. Constipation means what? Can anyone tell me what do you mean by constipation? Okay, fine. So then abdominal pain you are going to get. This is the main thing you have to remember. The sustained fever. So that is the 39 to 40 degrees C. Okay, 1 minute. Anyone tell me what do you mean by KABJ? KABJ means what, student? Okay, I understood. That is any mnemonic for the symptoms? Any mnemonics you have created for the symptoms? Okay, so these all are the symptoms of the typhoid. Okay, constipation. Okay, you're not getting the bowel movement. Okay, so that is what fecal matter not released. Very good. Yes, fecal matter is not released, right? Yes, so that is what we call it as a constipation. Yes. So yes. So then coming to the abdominal pain. So student, here you have to remember in all of the fecal oral route. Okay, you know whichever the disease which is going to be spread through the fecal oral route, you are going to get the abdominal pain. Okay. So abdominal pain and sustained fever. This is a very important thing. Okay. Sustained fever for 39 to 40 degree. They may ask you that, like this question they may ask you. So they will give you the typhoid, which of these is the characteristics of the, which one of the following statement not belongs to or belongs to the typhoid. Okay. They may give you that the typhoid is caused by the Salmonella typhi and it is going to be spread through the fecal oral route. Okay. Then the main character is sustained fever for 39 to 40 degrees Celsius. Okay. So like this, they will ask you. So that's the reason you have to remember this thing. Okay. So then, which is the diagnosis test mainly for the typhoid? Widal test. I have told you Widal test. Okay. Fine. Then coming to the next disease, which is the next disease? So that is the pneumonia. So I know you all remember that pneumonia, whenever the person was affected by in the starting, in the corona starting, if the person was in the first wave, the person was affected by the corona means he is going to get the pneumonia, right? What is that? The virus is going to be affect the lungs also, right? The pneumonia is mainly characteristic of the fluid accumulation or the mucus accumulation in the alveolar of the lungs. Okay, in the alveolar, you can see in the lung there will be a balloon-like structure, right? In the alveolar of the lung, the mucus is going to be accumulate. Okay, so that is what the main characteristics of the pneumonia. Okay, so it is going to be caused by Streptococcus pneumoniae. Okay, it is going to be, how it is going to be transmitted? It is going to be transmitted by droplet infection. For example, if you see the person is having the pneumonia. Okay, so if the if they spit anywhere, the sputum of the patient is going to carry this Streptococcus pneumonia. Okay, the sputum of the patient is going to cause the carry this Streptococcus pneumonia. By that, you are going to get the disease. Okay, so by that you are going to get the disease. So that is what we'll call it as the droplet infection. The mainly by the sputum. 1 minute. Mainly by the sputum of patient. Okay, student, fine. So then what are the symptoms is going to show pneumonia patient? It is going to show the chills, okay, chills. Then going to show the chest pain. Why the chest pain? So whenever the alveolar was infected, it is very difficult to exchange the gases, right? The oxygen and the carbon dioxide. So due to that, he is going to get the chest pain is also, okay, chest pain and shortness of the breathing, obviously due to the deficiency of the gas exchange, and is going to get the fever also. Then bluish and grayish lip and nail color. The nail color and also the lip color is going to be turned into the blue color. Okay. So the mainly reason is where the carbon dioxide was increases in the body, where oxygen was decreases in the body. So there is a main reason to increase the, so it is going to cause the coloration of the lip and the nails into the blue color. Okay. Fine. So then what is the test is going to do for the pneumonia patient? The lungs is mainly affected, right? For them, they will do the chest x-ray. You know, student, when they do the chest x-ray, they will give the scores, right? Scores. Based on the score, they may tell you how much the lungs was affected, whether the one lung is affected or the both the lungs is affected. Both based on that, they will give the score, right? So this is mainly the diagnosis test. Okay, mainly the chest x-ray and the CBC. Okay, fine. I think you understood this. Whichever the things you have to remember here, mainly the causative agent and how it is going to be transmitted and which are the symptom and also the diagnostic test. They may ask you this type of the questions in the statement wise. Okay, fine. So let us go to this. Is the two things we are going to study in the bacterial disease. Which are those things? One is the typhoid and another one is the pneumonia. Fine. So next we will go to the viral disease. Okay, in the viral disease, which are the so many patients, so many students are confused with the bacterial disease and the viral disease, right? So yes, so here I have given some of the viral diseases to remember. Okay, just remember this. Okay, so which are the viral diseases, student? smallpox. Okay, smallpox. And the smallpox was eradicated in the India now. Okay, we are not having in the India, we are not having the smallpox now. Okay, fine. So then chickenpox and common cold, everyone was suffered by the common cold, right? Yes. So then measles, mumps, and hepatitis B. Hepatitis B is going to be affect the liver. Okay. So that is the thing. And polio is also eradicated in the India. Okay. Then coming to the rabies and dengue fever and chikungunya and AIDS, HIV AIDS. Okay. So these all the things will come under the viral disease. Okay. So just remember which are the viral disease and which are the bacterial disease like. Okay. Fine. So then in the viral disease, they are given only the common cold. Okay, let us talk about how the common cold. I think everyone know about the common cold, right? But we don't know which which is the causative agent of the cold, right? Yes. So we know that it is a viral disease, right? Which viral it is going to be caused? Yes. The causative agent of the common cold is rhinovirus. Okay. Rhinovirus is the common cold causing agent. Then see here how it is going to be caused by the droplet infection. We all know that if any person is having the cold, by sitting with that person or by playing that with person and by using that person use it some pens or pencil, you're going to get the cold, right? Yes. So because that is by the droplet infection, right? If our friend is beside our friend is having the cold, means after some 2 days we are also going to get the cold, right? Yes. So that is mainly due to the droplet infection. Okay, fine. So which are the symptoms? So running nose we are going to get, and the red eye, and the fever and headache we are going to get, and the cough and the sore throat. Whenever we are affected by the cold, we are unable to talk also, right? So it is going to be affect the throat also. So here you have to remember that it is mainly going to affect the respiratory tract. Okay, it is mainly going to affect the respiratory tract. Respiratory tract. Okay, student, but not the lungs. Okay, but not lungs. Okay. So this is the main difference. Okay. It is going to affect the respiratory tract, but it is not at all going to affect the lungs. So that's why common cold, it is a common. Okay. Fine. Okay. Coming to the protozoan disease. Okay. So I think you understood this. So here we have studied about the bacterial disease. So that is the typhoid, and another one is the pneumonia. Okay. And third one we have studied about the viral disease. So that is a common cold. Fine. Okay. So now we are going to talk about protozoan disease. Protozoan disease. Protozoan. Okay. The mosquito was entered to our class, right? Yeah. See here, the mosquito was entered, right? Yes. So there's a protozoan disease. Okay. Let us talk about the protozoan disease. Can anyone tell me how many types of the protozoan disease you know? In the class only I have told you, right, today. So in your textbook, you have the malaria and the amoebiosis. The another one you are having is the, so another one, the disease I have told you, the African sleeping sickness and the American sleeping sickness, that is going to be caused by the trypanosoma, right? So these all the things will come under the protozoan disease. Okay, fine. So malaria is going to be caused by the protozoan. Okay, let us talk about. So student, before everyone know that malaria is going to be caused by the foul smelling hair. Okay, foul smelling hair, you are going to get the malaria. But that is not the truth. Okay, so then how we are going to get the disease? So one of the scientists, Leveran, okay, one of the scientists, Leveran, has told that it is not going to be caused by the foul smelling hair. It is going to be caused by the protozoan. Protozoan. Okay. The second thing, it is going to be caused by the female Anopheles mosquito, right? It was told by another scientist called as Ronald Rose. Okay. Ronald Rose. Okay. Ronald was told that it was going to be transmitted by female Anopheles mosquito. Female Anopheles mosquito. Okay. Mosquito. Okay. Fine. So see here, it is going to be caused by, this is going to be caused by the 3 species mainly. Okay. Which are those 3 species? Plasmodium falciparum, Plasmodium malaria, and Plasmodium vivax. Okay. So student, here in the exam they may ask you. So like this question. So which one is the malignant here? Which is the very toxic, which is going to be called the malignant malaria? So it is by the falciparum. Okay. So falciparum is going to cause malignant malaria. Okay, malignant malaria. So then when coming to in the India, the malaria was spread through the Plasmodium falciparum and another one is the Plasmodium vivax. Okay, fine. So here you have to remember three species. One is the falciparum, another one is the Plasmodium malariae, and third one is the Plasmodium vivax. Okay. So do you have any questions here? So let us pause for a while. Do you have any questions? Kindly tell me. Do you have any questions here, student? If you don't have any questions, means let us go to the life cycle of the malaria. Okay. Fine. Fine. So how this malarial cycle is going to be? Okay. So see, student, whenever we are talking about the Plasmodium vivax cycle, life cycle, so it is a digenetic. Okay. We'll call it as this is the digenetic. Digenetic. Why we'll call it as a digenetic? Digenetic because it is based, the life cycle is depend on two hosts. Okay. Based on two hosts. Okay. 1 minute. I will tell you here. Okay. So it is called as digenetic. So why we'll call it a digenetic? Because it is depend on two hosts. Okay, which are those two hosts, student? One is, see here, one is the human and another one is mosquito, right? Mosquito. So that's why we'll call it as the, that is digenetic. Okay, monogenic means it is depends on only one host. Okay. So let us talk about, for example, if you see the mosquito is having the malaria parasite. Okay, that parasite was called as the Plasmodium vivax. Okay, so the mosquito is having that parasite, right? Parasite in its saliva. Okay, that parasite we will call it as the sporozoid. Okay, sporozoids. Okay, it is in the mosquito saliva. How this sporozoite will come, we'll study about this. Okay, just we'll think that, just listen here what I am telling. So sporozoite, now it is in the mosquito saliva. Okay, sporozoite. 1 minute. Sporozoite. Okay, the sporozoid we will call it as the infective stage. Okay, infective stage of malaria. Infective stage of malaria or the Plasmodium vivax. What it will do now? This mosquito having the saliva, right? The mosquito was bite to the some other person. Okay, bite to the person. Okay, some humans. Okay, it was bited. Okay, what happened? It was bitten to the humans. Bitten. Okay, bitten to the human. Okay, so now what will happen? Along with the saliva, going to, along with saliva, it is releases sporozoids. Okay, so sporozoid was released into the body, right? Where it is released? In the blood. Okay, so now what will happen? From the blood, it was traveled to the, from the blood, it will travel to the liver. Okay, students, see here. So now the mosquito was bitten you, right? The mosquito was bitten you. Now that from that saliva, it is having the sporozoid. Along with that saliva, it is releases the sporozoid into your blood. So in your blood, the sporozoid was, that is the sporozoid was now moved through the liver, travel to the liver. Okay. So now what will happen? In the liver, it is going to affect the liver cell. Okay. Liver cell, what we will call it as, student? Hepatocytes, right? Yes. In the liver, it was goes into the liver cells. Okay, see here. It will goes into the liver cell and it is affecting the livers. Okay. It is going to be multiply in the liver. Okay. Multiply in the liver. This stage, we will call it as the schizogamy. 1 minute. Schizogamy. Okay, student, this stage we will call it as the, this is the asexual reproduction. Okay. By the asexual reproduction, okay, by the asexual reproduction, it is going to be increase in the number. Okay. One sporozoid was entered and it was traveled from the blood to the liver now. And in the liver, in the liver, what will happen? The one sporocyte was increases into the many number. Okay. One sporocyte was multiplied by the schizogamy, a sexual reproduction process, thereby increasing in the more in the number. Okay. More in the number. So now what will happen? It will come out from the liver cells by rupturing the cells. Okay. By rupturing the cell, it will come out. See here, 1 minute. Okay. Liver cell was ruptured now. By rupturing the liver cell, it was come out. Okay. So come out, right? So now this stage, we will call it as the merozoids. See here, student, we will call it as the merozoids. Okay. The stage, when this infective stage, the sporocyte was increases in the, it was multiplied in the liver cells. That stage, we will call it as a schizon. And that process, we will call it as a schizogamy, right? From the liver cell, it was burst the liver cell and it is coming out from the liver cell. That we will call it as a merozoid, right? This merozoid, now what will happen? It will enter into the blood. See here, it will enter into the blood now. In the blood, there will be a RBC is present, right? RBC. See here, it was entered into the blood now. So now in the RBC, it was entered. Okay, in the RBC, it was entered. In the RBC, what will happen? See here. In the RBC, there is a hemoglobin is there, right? Hemoglobin, right? What it will do? It will separate the heme. It will separate the heme and it will separate the globin. 1 minute. I will write it neatly so that you will not get confusion. 1 minute. See here, I will specifically taken the red blood cell, RBC. Okay, in the RBC, what will happen? See here. In the RBC, what will happen? In the RBC, there is a hemoglobin. Hemoglobin is there, right? It will break the heme. It will break the hemoglobin into the heme. And another one is the globin. Okay. So it will feeds on the globin. Okay. It feeds on the globin. And the heme was converted into the hemozoin. Okay, student. The heme was converted into the hemozoin. Through the hemozoin, you are going to get the fever. Okay. But from why the malaria patient is going to get the fever? Well, today he gets the fever means tomorrow he is not going to get the fever, right? Because whenever this red blood cell was broken, it is going to release the hemozoin. Okay. Hemozoin. Thereby, he is going to get the fever. Hemozoin is the main thing. It is going to cause the fever in the malaria patient. Okay. So see here, it feeds on the globin now, right? So see here, it is in the red blood cells, right? In the red blood cell, it is going to cause all the things, right? See here. So now what will happen? In the RBC, it is going to be rupture, okay? So it is going to be rupture the RBC and it is going to affect the another RBC, okay? It is going to be rupture the another RBC, okay, student? So this stage where it is going to feed on the RBC or hemoglobin, right? So that we will call it as the trophozoid stage. Trophozoid stage. Okay, trophozoid stage. What is the trophozoid stage? The feeding on the RBC, we will call it as the trophozoid stage. Okay. So then what will happen? So some of the merozoids is there, right, in the blood. Some of the merozoid is converted into the gametes. See here. Some of the merozoids is converted into the gametes. Okay. So see here. Now these gametes was moved into the superficial vessels of the skin. Superficial vessels of skin. Okay, superficial vessels of the skin. Okay, see here. Now this vessels is having this gametes, right? This gametes. So now what will happen? The mosquito was suck this blood. Okay, this mosquito suck the blood. Sucks blood. Okay, see here now. Mosquito sucks the blood. Through the mosquito, it was taken the gametes, right? Male and the female gametes. Okay, this is the male and female gametes was taken by the mosquito, right? So now what will happen in the mosquito intestine or the stomach? Okay, in the stomach or intestine the fertilization is going to be happen. Fertilization is going to be happen, and it is going to be it is going to form the sac-like structure. Okay, it is going to form the sac-like structure. In the sac-like structure, it is going to be have this sporozoids. Okay, in the sac-like structure, it is going to have the sporozoid, and it will burst and release in the burst and release. Okay, it will burst and release. See here, it will burst and release in the body cavity. Body cavity. Okay, so now, so student, I think you are understood from here, right? So the gamete, the male gamete and the female gamete, it is in the superficial on the blood, in the skin. Okay, so now it was taken by the mosquito. The mosquito now, it was sucked the blood, and along with the blood, it will take the gamete, male and the female gamete. The fertilization is going to be happen in the stomach or the intestine of the mosquito. So then it is going to be formed some sac-like structure. In the sac-like structure, it is going to have the sporozoid. Here, it is going to have the sporozoids, right? So now what will happen? It will burst out this sporozoid, and it is going to be release these sporozoids in the body cavity. So now there's going to be seen in the saliva of mosquito. Saliva of mosquito. Okay, student. So this is how the life cycle is going to be seen. See here, this was the mosquito is having this. The mosquito is having this sporozoid in it. When it was while biting, it was along with the saliva. It was released of the sporozoid. The sporozoid here now enters into the liver cell. Here now it was enters into the liver cell. It was increases in the number, right? So this process we will call it as the schizogamy, right? Schizogamy, the process, asexual reproduction. So now see here, increases in the liver cell, it increases in the liver cell reproduction, then increases in the number, and by bursting the liver cell, it is come out into the blood, right? It is come out into the blood. It was feeds on the hemoglobin in the blood, right? It feeds on hemoglobin in blood, right? Hemoglobin in the blood. So then heme was released, and heme was converted into hemozoin, right? Then this hemozoin is going to cause the fever, right? So now what happened? So this stage, we will call it as the trophozoids. Which is that stage, student? Trophozoid. Trophozoid stage is the where the parasite which feeds on the hemoglobin. That we will call it as the feeding stage. Okay, feeding stage we will call it as the trophozoid. So then what will happen? This is some of the merozoids in the blood. This is enters into the blood, right? So some of them will get the confusions here, right? When it was ruptured the liver cell and entered into the RBC, red blood cells, right? That stage we will call it as a merozoid. Okay, that stage we will call it as the merozoids. The merozoids start feeding on the hemoglobin. That we will call it as the trophozoid stage. Okay. Some of the merozoid was converted into the gametes. Okay. Gametes. Now this gametes was moved into the superficial of the skin. Then it was bitten by the here. This person is having the malaria, right? Malarial parasite. Now this mosquito, along with the blood, it was sucks the, along with the blood, it will take the parasites. What is that? It is going to be take the gametes. Okay. Now this both the gametes is going to be fertilized in the mosquito intestine, right? It is going to be fertilized in the mosquito intestine where egg will make the sperm, right? So then what will happen? It is going to form the one cavity-like structure. In the cavity-like structure, you can see the sporozoid. So that is having the salivary gland. In the salivary gland, it is having the sporozoid. It is going to be released in the cavity of the stomach. Then through that, it is going to be released in the saliva of the mosquito. See here. So after the multiplication, what will happen? This is like a one cavity. Okay. In the cavity, it is going to have the sporozoid. So now this sporozoid is released into the cavity, in the stomach cavity. Now this will release into the saliva of the mosquito. Okay. This saliva this is saliva, this all the thing is the sporozoids, right? Sporozoid was reaches into the saliva of the mosquito. Then again, it is going to infect the another person. So then it is going to be reached from the blood to the liver. Then it is going to be multiplicate. Okay. So this is about the life cycle of the life cycle of the plasmodium. Okay. So do you have any questions? You can ask me. Okay, student, do you have any questions? You can ask me. Otherwise, we can end the class here. So before ending the class, do you have any questions? You can ask me. Okay, yeah. Thank you so much. Let us meet in the next class. Okay, thank you, students.